My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by two guests. I'm sitting down here today with Dr. Cole Barfield, the Chief Medical Officer, and Elena Gambon, the Chief Growth and Strategy Officer for First Stop Health. Dr. Cole, Elena, welcome to the podcast.
Hey, Norm. Good to be with you.
Thank you. Excited to be here.
Good. So for all of our viewers and listeners who are not as familiar with First Stop Health provides whole person care for employees, available for primary care, specialist care, urgent care, and mental health care. Dr. Cole Barfield has encompassed clinic and hospital settings, fostering his deep commitment to patient care. He was co-founder of WellView Health and has served as chief medical officer for two companies, including Century Health. With a medical degree from Vanderbilt University, Dr. Cole is passionate about providing patient care-centric care, blending clinical excellence and entrepreneurial vision. And also Elena Gambon previously was at Carum Health, handling commercial strategy and solutions. She was an executive at Alight and a venture research fellow at Rock Health. Prior to that, she was a market executive at Compass Professional Health Services, and Elena got her MBA from Cal Berkeley and is very passionate about solutions that are patient-focused. So welcome both, and excited to jump in to hear all the amazing things you guys are doing at First Stop, as well as diving in earlier in your careers.
Also, I will say I want to add one addition to Dr. Cole's bio, which is what we say in First Stop Health, which is he is possibly the kindest, most caring person I've ever met. And he genuinely cares so deeply about his patients, and you can tell when he talks about stories about them, which I'm sure we'll get to some today. But I feel like your bio doesn't do you justice when you just rattle off all your accomplishments.
Well, you're kind to say that. It's a joy to be working alongside Elena.
Well, thank you for the extra information about Dr. Cole. Certainly very helpful context. So we'll start with you, Elena. What inspired you to get into healthcare?
I think, a lot of people, I come from a family of people in healthcare. Dr. Cole's the same way, so my parents they actually met at NIH. My mom was an ICU nurse. My dad's an anesthesiologist. I kind of grew up watching them be just extremely servant-minded, other-focused people and helping patients. I mean, they were in their personal lives, but they were particularly that in their professional lives. And them being in healthcare really shaped kind of our family life. And I felt like it was something that I was called to do. I had a lot of personal health experiences as an individual, a lot of sick family members, watch how vulnerable it can make someone. And it felt like, one of the most noble ways to live a life is to go into healthcare.
Agree more. Cole, what inspired you to become a doctor?
Yeah. Well, like Elena said, I come from a family tree of physicians, but I also had a lot of physicians who went into a variety of different careers. Some stayed as practicing doctors, some went into business, one went into politics and policy. And quite frankly, one of my biggest mentors was my grandfather, and he was an internal medicine, primary care physician, and what I would say kind of dipped his toes into cardiology as well, but was a huge influence in my life. When I was in college, though, I was like, I don't know if I want to do all that schooling. So I was kind of like not so certain. I went to college and did politics and was very interested in policy at the time, and was writing my senior thesis on resolutions to the civil war in Sudan. At the time, it was a 25-year civil war. And I called my uncle who was in politics, and I said, hey, listen, I want to go to Sudan in between my junior and senior year, and I need to do some research for my senior thesis. And he said, oh, okay, well, I can't get you through the government. You got to undergo like a kind of with mission organization and stuff like that. So I actually went over there. And I did research on my senior thesis, but the thing that was most impactful actually was working with doctors. And so I worked with a doctor there who was a general surgeon and also a family practitioner in a small rural village in the southern part of Sudan at the time. And honestly, it stripped away all of the complexities of the American healthcare system, and all it was a doctor taking care of a patient. and I absolutely loved the experience. I was able to see like immediate transitions to like, from sick to cure. I also experienced death for the first time with some kids there. That was really hard for me, but just so impactful. And it made me say, you know what? I don't care how much schooling I have to go through. The heart of medicine and the heart of caring people is where I want to be. And so I went back my senior year and started taking all the pre-med requirements and everything like that. So it's an unusual journey, but one of them.
Yeah, it's a great story. And what inspired you to co-found Century Health, formerly WellView?
Well, that's a good question. So I actually went through medical school at Vanderbilt, as you mentioned, and went through residency at that time. And in residency, I actually saw just a lot of inefficiencies in care. Like someone may be better, but they couldn't get to the nursing home or the skilled nursing facility for 4 or 5 days, and prices of pharmaceuticals were expensive, all that stuff. And so I was just trying to think, I need more information. I need more education. So I actually went to business school at Vanderbilt, and they had a healthcare MBA track, and I absolutely loved it. 75% of my classes were all healthcare related, and just loved it. And so actually my second year in business school, I had the opportunity to meet another who ended up being my co-founder. And really our goal was to acknowledge at the time Obamacare was coming out, so there was an emphasis on prevention. And also the challenges were still there with regards to access and chronic disease management. And so the core of it was really trying to say, can we improve prevention and be proactive in care, but also really be able to focus around specialty care and certified diabetes educators, nutritionists, dietitians, and health coaches, really to surround a patient with behavior change and to be able to help patients along that journey.
And walk us through some of the successes that led you to get acquired by First Stop.
Well, yeah, God, that's quite a story. I would say like a couple of things were very central. I think the co-founder, James Story, and I, one of the biggest successes initially was finding a client that shared the vision and was willing to grow with us. And I think that that client is still with us today, even at First Stop Health. And to me, I think that was absolutely essential within that first year of the company. The second thing was having a great funding partner who is willing to grow with us through the ups and downs of being a little stretched thin on some of it, in times of which we were really excited about some
And
of the
who was that venture partner?
Yeah, BIP Capital out of Atlanta, and they're actually still a minority owner in First Stop Health as well. So it was a great journey in that. And the third thing I would say, and this was probably the most important thing, and also led to a lot of what we were most excited about First Stop Health, is the team. It's actually around, are you hiring the right people that are around the journey, that have the resilience for an entrepreneurship vision, that journey of the ups and downs, but also just have a complete eye for caring for patients, and having that patient-centric attitude was so important for us. And I'm glad to say, when you look at like actually the First Stop in the acquisition, so many of those people that have been alongside this 10-year journey with me, with WellView and Century and now into First Stop Health, are still with us today. And it gives me such joy to see that.
And Elena, what inspired you to join First Stop Health?
I was working, as you mentioned, as a patient advocate when I started out my career in digital health. And I was on the phones answering calls in Spanish and English, helping people find high quality gynecologists in network, and answering questions like, why does your EOB not match your bill? And I had learned so much about what it is to be a patient when you're really confused by healthcare. And I felt like the solution we were delivering was just exceptional. And when I moved into the business side and kind of out of operations, I learned that our usage rates were moderated, right? And we had a lot of people at employers who were not calling in. Mm-hmm. And I was sort of struck by that, because on one hand, it was this undeniably useful, beneficial thing. And on the other, it seemed like the majority of people at these employers had no idea kind of that we existed and that we could help them. And I became sort of obsessed with this idea of usage in specifically PEPM, but also more broadly, point solution environments in employee benefits. And so when I came across First Stop Health through a former coworker, I initially was drawn to it because of the levels of usage that First Stop Health is getting in the market. That is still today the reason why most of our clients either look at us or make a decision on us or partner with us.
Yeah, and walk us
And
through like
yeah,
what statistically you guys are doing at First Stop that's pretty rare, and more importantly, how do you do it?
uh, so on the whole, across all of the solutions we deliver, book of business stat, we're seeing about 60% annual usage. 1 in 3
Insane.
people have a visit with us, and it's not, it's great if someone opens an email, it's great if someone downloads the app, but they're not a user until they've had a visit, because healthcare doesn't happen until they've actually formed a relationship or gotten into the virtual room with a provider. And so those are some of the statistics we talk about. Another one that I think is really impressive is in the primary care environment, 50% of the patients we see have not seen a primary care doctor in the last 12 plus months. So it's not just sort of the quote unquote worried well that we get to help. It's folks who have been completely stuck, who have just never felt seen by the system before. And I think the usage is a function of a couple of things. So number one, we think a lot about the behavioral economics of the patient and just how you have to have the most frictionless experience logging in, getting access. And that means it's $0 visit for the patient. You can talk to a physician in minutes, you can schedule in days. The actual act of going through the app is smooth. It takes a minute to quote unquote register. And it's like the little human centered design, things like that, that make the experience easy. And then beyond that, we spend a lot of time in the prompting, the reminding, the sort of outbound engagement that, like most folks, is not one size fits all, needs to be moderated and titrated based on age and gender and demographic and need. But the most important thing is the business model, which is 100% of our fees are at risk. And if nobody uses this, the client pays nothing.
Yep.
And
That's
put
how
simply what that
employers
means,
are like in these days.
yeah, put simply what that means is we have to care. So it gets done. When the business has to care about something and everyone's looking in that direction, then the outcome is pretty achievable. So it's a combination of those things.
It
Yeah.
shows your company believes in itself and its ability to deliver value for customers, which is really, really good to see. You mentioned that you guys are getting incredible usage, comparative, to the rest. What is First Stop Health like a good alternative for? Like what are other vendors? A lot of times people try to like understand markets by saying, well, this company competes with these companies and, like that's the bucket I put them in. If someone's unfamiliar with First Stop, like what is First Stop a great alternative for, either based on like status quo or maybe they've tried another vendor and maybe not gotten the results they wanted?
Yeah, I kind of like to think about it. There are flags in both the data and patient feedback that signal our potential need. So the first is if you've got a client who maybe they have a telemedicine solution in place, maybe they don't, but they've still got pretty high avoidable ER spend. That is a very clear signal that we can come in and our urgent care solution can be valuable. On the flip side, you might have a population where there's 4 to 5% of the population's getting their preventive exams or seeing a PCP, and they've had a wellness vendor in place, but they're not actually sitting in the room with the physician. That's another clear example of a way that we might come in. So it kind of depends more on what are we trying to solve for? What are we seeing in the data that's projecting or anticipating risk downstream? A lot of the time we have clients put us in place because they're in rural or geographically dispersed areas, and they're waiting months and months for visits, primary care, mental health, even though they've got something in place today. So it's an engagement dynamic, it's an access dynamic. It's also a really great tool if you're seeing trends in your claims that you want to reverse, and that when that is a function of engagement or a lack thereof, this is a particularly valuable solution.
Yep, totally understand. And Dr. Cole, what inspires you most about the mission of First Stop?
Well, I mean, going back to my personal experience. So even though I co-founded WellView and Century, I was 95% clinical. So I went back into clinical practice and took care of patients in the outpatient and inpatient setting. And one of the biggest challenges that I saw was patients had a hard time getting access to me. I had 2,500 to 3,000 patients. I had visit limitations with regards to length of time. And also, I referred to my friends who are really good. I mean, they're some good clinicians, but I didn't know if they were in network. I didn't know if they were high value with regards to what their outcome metrics were. I just knew that I could call, pick up a phone, and get them in quickly. And that to me, there was a dynamic shift, right? And also, I couldn't get people into mental health, right? And so there was just such challenges when I was taking care of a diabetic or a heart failure patient, but who couldn't get access to mental health support, and I knew it was bringing down some of the challenges of their chronic disease, their depression in most cases. It was just such a challenge for me. And so going to a model like this where First Stop Health can actually do urgent care, so quick need, primary care, and not only just a primary care doctor, but we have dietitians, we have certified diabetes educators, we have health coaches, we have all of those other specialists around there to really surround the patient with the appropriate care. And then we have navigators, we have referral specialists. So all of a sudden, and then you can refer into mental health. So all of a sudden you empower the patient to have access to great care. And to me, that is the core. You're eliminating barriers of cost and you're giving great access. Now, we can't deliver everything in virtual care. That's not the point. But we want to deliver really well what can be delivered well in virtually. And then if we need to refer in person and do it in a way that is in network and high valued referral partners.
Yep. So Elena, as Chief Growth and Strategy Officer of First Stop, you're in charge of new growth, marketing, corporate product strategy.
Everything, basically.
Yeah. There's a lot of
Well,
things.
we just hired an incredible chief marketing officer. Thank goodness, way better than me at marketing. And Will Sutliff, he's fantastic, but you are correct in all the rest.
Yeah, so I think that title, like strategy, is very ambiguous. And I think a lot of founders and CEOs like have a hard time like even understanding if I hire like a strategy executive, like what am I paying them to
Right.
do all day? Can you walk through some of the incredible accomplishments you've had and why founders should consider, having a chief strategy officer like on the exec team?
Yeah, this is such an interesting question. And for me it's personal because before I was the chief growth officer, I was just the chief strategy officer. And then I was privileged and fortunate enough to do both. I will say at First Stop Health, strategy is a shared role amongst the entire SLT. And I cannot stress that enough, which is that in any good company, the diversity of thinking that differential roles and experiences bring to the table make a good strategy. One person alone cannot do strategy. And so I think there's this misconception that a chief strategy officer is the person on the team doing the strategy. And I think what it is more is in any project, when you name someone who is accountable for something, they ensure it gets done. And so I see my role as more the person in the room that has to constantly remember to ask the question about the 3-year or the 5-year, not just the in-year, and to help other people on the team do their best strategic work, because that's where the genius is. It's not from my brain. We do this thing at First Stop Health where we align our in-year and out-year thinking around 3 pillars: affordability, delight, and engagement. And we just got off this really awesome executive onsite where each of the members of the SLT brought a 3 to 5 year strategic, really it was like a research paper, it was pretty cool, to the group around who we wanted to be in that pillar. And so it's creating the frameworks for other people to think strategically, not doing the strategic thinking themselves. And when you're caught up in the business and you're in your adolescent phase as a business, or you're the CEO or the CFO or the chief medical officer, you have your day-to-day work to do. You have your people to manage. You've got your patients to care about. And so sometimes the long-term thinking goes by the wayside. So it's just I think it's just a flag in the ground, not to diminish the role, but it's helping other people do that work primarily.
Well, I would say one thing, Elena, that you don't give yourself enough credit. She's an impeccable leader. One of the other things that I love about it is because she's on the growth side of things, she's also seeing what else is in the market, what are new opportunities, and then also being a little bit even pushing the envelope. Where can we as a company go forward in 3 to 5 years. And so that aspect around growth and strategy, I feel like has been really aspirational to me. And I've loved the leadership that she's been able to provide. And I'm with her on the sense of like, you need a group of
You
people
need the
with different
team.
perspectives, but man,
Yeah.
it's been really powerful for us and certainly powerful for
Yeah.
me to see her lead from that growth and
Well, that's kind.
strategy.
Well, I think the cool thing about it though is so like, strategy is inherently, I think, tied to growth in a lot of ways. But when you're at the stage of company we're in, it also has to be tied to profitability and sustainability. And so it's this combination of like figuring out how the top and bottom line can kind of hum together, what your virtuous cycle of growth is so that there's a positive feedback loop and there's not friction in the cog. And it's like systems thinking, which I really enjoy. And I think is, it's really creative, fun work. I feel privileged to get to do it. That's very nice of you, Cole.
It's definitely an area that a lot of companies in the market are probably not emphasizing a ton right now. So I give First Op a lot of credit, and forward thinking, because there are a lot of companies that I've seen over the last 3 years, kind of since the like post-COVID boom and now in the slowdown, where product marketing, and strategy have really taken a hit, like in terms of like new hires. A lot of companies are saying, well, if it can't drive immediate revenue or save us money like right away, we're not investing in it. But again, I think First Stop has been here 10 plus years, going to be here for many years longer. They're more thinking, hey, like we got to make sure we're providing great care 3 years, 5 years from now, and not just focused on making it like quarter to quarter, like some of these other growth stage companies feel the pressure to do. So, both of you have had just tremendous careers already. Can't wait to see what you guys both continue to accomplish. What's one career defining moment for each of you that shape how you lead today and how you, bring value to clients every day?
I'm so curious, Dr. Cole, how you're going to
Let me
answer
go
this.
first.
Yeah.
I mean, one of my probably most career defining moment, it was actually in clinical care. I mean, it was actually at the height of COVID when it first came out. It was in early March, and I was taking care of one of my patients, and I had the opportunity to both provide outpatient care, but also the inpatient care. And this patient was getting very sick and had some underlying medical conditions. And as a provider, and obviously as you look in AI, pattern recognition in medicine is one thing that you look for, and you kind of say, oh, well, these symptoms are all coming together, and this fits this, right? And then this is the treatment that needs to go down. Well, early on in COVID, we thought it was going to be like every other virus. So intubating a patient was the right thing to do, right? And so we intubated that patient. And unfortunately, as a lot of people did during COVID, that was actually not the right thing. You want to try your best not to intubate them, but we did not know at that time, right? And so for me, the career changing moment, it's a moment like, I'm already a little bit emotional about it, but like, to me, it's around looking at like the status quo of how you do things currently, and you constantly have to reevaluate, is this the right thing still? Can we do something different? Can we do something better? And I think that not resting on the laurels of what the past has provided, but really looking forward to the future and kind of continuing to question is one of the things that I most take away from that clinical experience, but it plays very well into kind of the business role as well.
What about you, Elena?
Can I share two?
Please.
Okay. Okay, so the first one was very early on in my career when I was a patient advocate, as I mentioned, on the phone, answering calls. One of the calls that I had answered and had with a patient had been, they were all recorded for QA, but one had been pulled by one of our members, one of the leaders of our marketing and sales team, as an example for what a patient and advocate interaction might look like in the sales environment. They were meant to show it. And because of that call, I had the ability to go into kind of growth facing, client facing environments and eventually worked as a market executive. Mm-hmm. And the reason that was really defining for me was this idea that, I probably took 1,000 calls that week. I can't quantify it, but it was this reminder that you have to give 150% in every single thing that you do, even if it's just the rote thing that you are doing every single day, because you never know when that's the call that someone's going to listen to and decide you're worth giving a shot. at a different role. And I was just really overwhelmed by that when I learned that that's why I had the ability to do that. So that was hugely defining. I tell that story at my sales
You never
kickoffs.
know when your opportunity
You
comes.
just never know. Yeah. And the patient deserves it, right? Like your peers deserve you to give 150%. The patient deserves it. Your stakeholders deserve it. So that was kind of one. The other one is more recently. So Dr. Cole and I have the extreme privilege of going through executive coaching along with the rest of the SLT at First Stop Health. I cannot speak highly enough of this process. I literally divide my life into before and after this process. And I learned so much about what we call, reactive tendencies as a leader. And that I have just vulnerably, like, I tend to be a little controlling and can lean autocratic when I'm stressed, when things aren't going well. But that's not how you instill trust in a team. That's not how you build to greatness. You have to hire incredible people and shape them and move them through your actions, not do things for them. And it was just this incredible light bulb moment for me about what it means to be a vulnerable, authentic leader. And it's changed my personal life too. And I hope that every person who has the ability to manage other people gets an experience like that, because it can totally change how you operate.
Yeah, man, I would second that. Our CEO Tiara Gunlock sets kind of the stage for that.
Oh,
But
she's amazing.
having an executive team that's centered around vulnerability and authenticity
Mhm.
is different, right? You have the ability to let go any facade and be able to actually say, like, how are you feeling about this one thing? Like, are there some hardships? And it's okay. Let's lean in. If there are, don't put a facade to it. Just say what you're wanting to say, so that we can work together to solve it. And that is it's a beautiful moment that I've had the experience of being a part of for the last year at First Stop Health.
Very special. Very special.
Great. I love it. What do you think it means for patients to have 24/7 access to doctors? 3 minutes or less to talk with a doctor at First Stop. Like, how does that impact patients, and how do you see it impacting healthcare more generally? And I'll ask both of you.
Yeah. I can answer first. I guess this is a little more philosophical. So Cole, you'll probably answer this from a patient experience perspective. But it is my belief that many healthcare decisions, unfortunately, are made from a place of fear or information asymmetry. Meaning someone is in one of the worst places they could be in. They're afraid. They don't know what to do. And they kind of knee jerk to wherever they think they're going to be seen the quickest, the safest. They're guaranteed to get care. Sometimes that's the ER. Often it's the ER. Or they make decisions not through their own fault, but without enough information about who the right provider is, what the next step is, how to maximize their benefits. And so inherently, when you have a clinical professional that you can talk to in minutes, who's either triaging and treating or triaging and recommending a next step, you eliminate some of that initial fear and information asymmetry. And it is made all the better when the patient pays nothing for it, because then there is no aversion to picking up the phone and just making the call. And you end up sending people to the right in-person care when they do need it, or completely avoiding it altogether because it wasn't necessarily clinically appropriate. So I think it is a central tenet of what we do. The urgent care solution is a true engagement and catchment tool for primary care and mental health. And it is often the most common solution that a client will buy for that reason.
Mm-hmm.
But I don't know, Cole, do you have anything?
Yeah, I would just say, I mean, it's just not out there, right? In the in-person care, you just can't get access to doctors. And I love the fact in our urgent care model is that, yes, we can treat simple sick issues. That's true. But we also have, it's a lot of urgent care, emergency room, internal medicine doctors. We have some OBGYNs on there too. And you can get really good at navigating appropriately, right? We've had patients who thought they had appendicitis and they don't. And that we were able to save that. But we also had people call and that were very concerning to say, hey, listen, you actually do need to go to the ER, right? And so that appropriate navigation from a specialist is really important. And being able to do that in just a quick moment is so so impactful. And the way that I love First Stop Health deals with employers and the way in which we market directly to them, we don't have the plan market our services, right? We are going directly to them. So it gives them just a little bit more access to us from an engagement perspective, so that we're able to, as Elena mentioned, really market to what their needs are so that they know that we're here to support that continuum. And outside of urgent care, I would just say, like, you can see a primary care doctor in like under 3 days, mental health in under 3 days from a scheduled appointment. If you're having crisis in mental health, you can talk to someone in minutes. So you start looking at that, and that access is just a massive thing, and it will only get worse in the in-person setting, as we see with doctor shortages and things like that in the next 10 years or so.
Well, and we're in this culture of, oh, sorry, Norm, go ahead.
Go ahead.
No, we're in this culture of immediacy, right? I mean, there's this fundamental expectation around immediacy, and there's attention span dynamics that are going on, which on one hand is like really beautiful because there's more democratization of access to things and services and information than there ever has been before. Like, the technology is really wonderful, but it also kind of creates this expectation where if you're not doing that, you lose people. When they're finally brave enough to raise their hand and say, I need help, if you're not available right now, you lose them. And I think that's what a lot of our usage is attributable to that, is that we just are there by the time they need us.
Yeah, and Elena, I know you are a geek like I am, and you study human behavior.
Yeah.
So I have a hypothesis. I just want to see what your thoughts
Let's hear
are
it.
on it.
Yeah.
I think every generation, like as we keep going into the future, will less and less like to make decisions for themselves. And like they won't necessarily embrace just making a decision, being accountable to it, and sticking with it. So I think any organization that helps patients make decisions will only get more and more popular over time because it's a generational societal factor.
Norm, this is so interesting. So have you heard about or read about, or Dr. Cole, you too, the studies that have been done around the emotionality of decision making? So basically, this idea is inherently you can logic your way to a decision, but you can't make the decision without emotion. I think, and there've been a couple of studies where they studied people with damage to the emotion part of the brain. And the one thing they had in common was that they could reason their way to why they should do something, but they could never actually do the thing. And if you forget that people are inherently emotional beings and that healthcare is personal and emotional, to your point, you lose the ability to make decisions over time or influence those decisions or help them. And I think there's a possibility for technology to maybe run that risk, right? Because it becomes less personal, and we just have to be really attuned to it. So I totally agree with you. I think it's a potential path we might be going down, but I think there's ways to subvert it if you understand kind of the psychology of the decision making in the patient.
Yeah. We will see. Time will tell.
Time will tell.
One. How do employers save money with First Stop? Because again, right now I'm seeing a trend with employers where if something can't guarantee cost savings in year one, it's immediately like second priority or worse. And a very few companies are able to show real cost savings right away, ideally in month one, but at the very least in year one is kind of like table stakes to get their attention. Can you walk us through how the employer and even the employees save money with First Stop?
Yeah. The saving story at First Stop Health is inexorably tied to the fact that we are a direct virtual care company. So direct care meaning we exist on top of, outside of the traditional fee-for-service networked healthcare environment. We do not receive reimbursement in the form of claims. We do not bill claims. We receive a single lump payment that is capitated, much like a value-based payment arrangement for the services rendered. And we put 100% of our fees at risk. So what that means for a client is that inherently the value of the solution, and I hate the word value because like, what does that mean? But the results of the solution, whether that's usage or savings, it's tied to the spend that they're making. So on a macro scale, that is a very important thing to know, because Our philosophy is that insurance, when it works like insurance, which is to pool risk for high cost claims, is a really important thing. But when it becomes the single arbiter for the patient physician or patient counselor relationship in the upstream, you kind of run into risks.
Yeah.
So the more we can do in a direct care environment, the healthier we can create patients, the more arbitrage we can remove from the system, because there's just less administrative overhead. Tactically, what that means for a client is that we are reducing or eliminating claims to the plan that don't need to happen, like an ER visit that someone came in with a urinary tract infection. They just need a macrobid prescription. They don't need to go sit in the ER and pay for $2,000, $700, whatever it is. We also are doing a lot of steerage. So Dr. Cole mentioned, if someone comes in and we know they need an MRI, we want to send them to the $400 global payment MRI, not the $2,000 physician and facility combo bill MRI. And turns out those two MRIs are actually quite similar, as we all know, in transparency in terms of
I
quality.
could talk about that one all day
Yeah.
if you've been following
Yeah.
the podcast, but I
Yeah.
won't bore our guests.
That's talk about information asymmetry. That one just, it's, and even still, it's been so many years and we've never tried to solve this problem.
And the worst
and
thing
then,
is not the prescribing provider oftentimes doesn't
has
even
no
have
idea.
transparency. They have no idea either. They're just
I know.
sending where they normally do.
And doing their best, but they don't have that information, right? They just don't know. And then the third way we save money is a true risk reduction. So when you've got a patient who goes from no PCP to seeing a PCP every month and the certified diabetes educator, and they're now, have controlled levels and they're taking their medication, their risk can be reduced anywhere from like 3 to 10% PEPY from an annual expenditure perspective. So it is immediate cost aversion because of the direct care model, and it is also a longer term investment. And what matters is recognizing the difference between those two things, and that a lot of what is being done when you're with First Stop Health is setting you up for next year's renewal or the following year's renewal, not necessarily always this year.
Well, thank you for educating us. Really, really insightful. And I do want to go back to what we were talking about before. I want to make very, very clear with, this younger generation, whatever you want to call it. I don't think it's any fault of their own. I think we grew up in a different environment. I think I was one of the last elementary school, middle school students that had to go to the library and use an encyclopedia or get
I know.
books to reference in a paper. So again, think about how we grew up, and I'll generously add myself to your group. When we had to do homework assignments or tests or whatever, we had a finite level of information, and we had to make the best of what we had, and with what we had. And then a couple years later, someone, who might be 3, 4, 5 years younger than someone like me, they had Google, and all of a sudden you had unlimited reference texts and unlimited articles that you could reference and books and whatever, as opposed to when, we were writing a paper back in the 90s or early 2000s, you had to go grab an encyclopedia, you had to reference hey, there's a handful of books. Do you have them available? And then whatever they had available, you're kind of okay, these are the reference texts I use in some sort of, written paper. So you had to make decisions based on what you had. Now there's an unlimited amount of information. There's an unlimited amount of opinions and
choice paralysis
of certain issues and thought processes. So for someone who grew up with that, there's no exhaustive list. There's never a point where you're okay, I have all the information to make a decision based on now. So it is harder for someone, who's in their 20s to probably make a decision than someone in their, 40s or 50s, because they grew up with a different way of making decisions, because I would argue to a certain point you had limited information and you were okay and used to making decisions with limited information. And now it's you have an unlimited amount, thus making it really, really hard to decide, okay, well, at this point, I think I have enough to make an informed decision.
I mean, Go ahead, Cole.
No,
Yeah.
I was going to totally agree with you.
Probably
Norm.
same with doctors, Dr. Cole.
Well, you see it. You see it in clinical practice.
Yeah.
People come to you now with information, whether it's correct or not, or whether it's around the right thing or not. But they're still looking for advice, and they're still looking for navigation. They're still looking for treatment, right? And so it is kind of a revamping of this kind of generation of how can we best equip them to give great access to specialists to be able to help them navigate and to help them make decisions when they have such great vast of information right accessible to their hands. And it will honestly, it will become even more prolific with AI, right? Like they're just going to get
Yeah.
better and better.
Yeah. And there's this interesting thing too that you're talking about, Norm, which is I think when our generation and older, when you have less access to information, one, it is easier to make a decision because you lack this choice paralysis, right? I mean, it's like there's a finite amount of options. You make the best fit decision based on your critical thinking skills. There's also this sort of deference to an authority or a higher power on things. And I think there's an element of patient care where the more AI comes into the picture, the more information is democratized, the more self-service and self-help there is. There's slightly less reliance on this authority figure, which is the clinician, which, in some cases, democratizing this stuff is great. And in some cases, you do really need to talk to someone who you can trust, who has been trained in this way. So it's this interesting balance of the good that comes with this extra stuff and also the danger to the point that you're making, which is just a lot harder to figure out where to go.
Cole, how do you see First Stop Health fixing what many things that are wrong in the healthcare system?
Yeah, I mean, it goes back to the two cores for me. I mean, it's financial barriers and it's easy access to care. Because right now, I mean, I really tried to be like the best primary care physician I could possibly be, and patients still lacked access to me. They still had difficulty getting to me. I still didn't know what they had access to. I didn't know if they had MSK access. I didn't know if they could go to a certified diabetes educator for $50 copay or $0 copay. I just didn't know, right? And so it's really around getting access to care at an affordable cost. And I truly believe it's around the right utilization in healthcare, right? So Elena talked about the importance of kind of prevention or giving good access to care in this arena, understanding that like the high risk conditions, we need the urgent care facilities, we need the ERs, we need the hospitals, right? But like let them do that and then give great access to care. And I will just say, Norm, and this goes to a little bit of your conversation earlier, it's like we're getting better and better at home diagnostics, right? And that will only increase. And so giving people virtual access to care immediately with enhanced diagnostics at home seems to be a very good sweet spot over the next 5 to 20 years as we move forward.
Great. I'll ask Elena first, but then, Dr. Cole will have you chime in as well. As Chief Strategy and Growth Officer, what do you see the next 5 years at First Stop Health? What do we have to look forward to?
If I'm not mistaken, I don't want to speak for everybody on the team, but I think where we're centering around is we want to expand what primary care means and can do as a direct care company. And I would say, so we offer urgent care, mental health counseling, and primary care. You could, in theory, wrap all three of those things under advanced primary care if you really wanted to. And when we think about adding arms of the service or additional features, it is in service of getting more people connected with that type of care. And then adding a team-based care approach to make sure that when there are subspecialists or certain expertise levels needed to fully treat the patient, we have that. So I think it's continuing to invest in that. And then personally, something I'm really interested in, which I think the rest of the SLT is as well, is increasing what it means for us to be at risk. Meaning we already put 100% of fees at risk for usage. But how can we make that story even stronger for a client moving forward? What else can we put at risk? How can we think about moving further up the value-based care spectrum in this direct care model so that it becomes sort of an undeniably easy thing to say, yes, if we flip this on, it will have impact within the structure of the services that we have today. So I'd say those are kind of the two on the product, and then on the revenue model or kind of service model side, those are the two areas that I think you'll see expanded.
Very exciting. What about you, Dr. Cole?
Yeah, I mean, for me, it's around, to clients. It always worries me. Just all the point solutions is just a real challenge, and I think simplicity for some of these, our core group is around small to mid market businesses, and when you look at that, they have small HR teams and things like that, and so
Yeah.
you want to be able to have simplicity around the things that can be simple, right? Not everything is simple, but really enhancing our urgent care, primary care, and mental health services. And primary care is not just around a primary care physician, but it's around a team of specialists to be able to help that patient, health coaches, diabetes educators, nutritionists, primary care doctors, and things like that. So that's what I would say in general is just simplicity around a single point that can really come in and serve a lot. I think from a clinical perspective, obviously GLP-1s is going to be a big one, cardiometabolic health, so much is aligned with that. I think if you're just going to be prescribing medications, that's not the way to go because the second you come off some of those medications. So it's really around, can we provide support that we do, right, with health coaches and dietitians to really support whether they're on the medications or whether they're off medications. I think that's a really key pathway. MSK is also, just looking at high cost, high spend areas of where you can navigate better. And when you think of musculoskeletal conditions, you can also think of pharmacy spend. Those are areas where if you can get high utilization in those areas, you can really navigate appropriately or treat appropriately. You can really reduce costs for clients, but also, quite frankly, really strengthen the patient journey around those conditions.
One proof point for the importance of like really quality primary care that I think is really interesting is the health statistics of the country of Costa Rica versus the US.
Mm.
I think they spend like per person a fraction of the cost, but each citizen has one primary care physician come visit them at their home annually, and they get much better clinical outcomes, within Costa Rica with paying a fraction, of what we pay per person. And I think there's a lot of factors to it. There's environmental factors, there's cost of fresh foods being cheaper than like manufactured foods, a lot of different things. But I think that's just a really, really good proof point that, more expensive doesn't always mean better. It's just where are you investing the resources? They invest,
Hmm.
on prevention as opposed to treatment, which I feel is kind of more of
Well, I
the
mean, Norm, and I can share with you after this, but if you look at some of the data around number of primary care physicians per 100,000 people around the world, right? The data is pretty clear that if you have a higher number of primary care physicians per 100,000 people, mortality rate actually goes down. It's all due to prevention, it's chronic care disease management, all those types of things. And so it's
Yeah.
really around core. Now, primary care may mean something different to a 20-year-old than it does to a 75-year-old. And so it's us.
Hmm.
We've got to try to figure out how do you get those people into the right usage appropriately.
Yeah.
what emerging trends within healthcare have you two most excited?
I think it's,
Yeah,
go
go
ahead,
ahead.
Cole.
No, go ahead.
I think it's pretty undeniable that we are in this sort of next cultural or technological revolution, right, with AI and generative AI. And I mean, it's interesting because if you look at the history of the last kind of like 200, 300 years, the time between these macro revolutions has shortened dramatically between like the agricultural and industrial and then technological and now this AI revolution. I mean, it's like they're basically be getting cut into thirds the time between. So I am excited about it because I think I mean, just based on the basic principles of supply and demand, with healthcare having relatively inelastic demand, additional technology is going to push supply curve to the right and drop price long term. I mean, I think it's pretty undeniable that that's what's going to happen. The thing that I'm worried about with it though is how you control for patient safety, how you build these AI models without losing human moments. So using them, as our CEO would say, to scale human moments versus replace them. And then to the extent that we're actually able to drop prices for people, it is up to the companies that are delivering that care to be ethical and not increase arbitrage. So if this kind of margin savings is going just to margin, that isn't actually helping the patient. If it is somehow being redistributed, which is, a very lofty thing that we like to think about. That's what we're trying to do here. I think it has the potential to pretty dramatically lower costs and improve quality, but we're just so at the beginning stage of that. I have no idea what it could look like, but it is extremely exciting to be at the beginning parts of what AI could do for healthcare in terms of quality and access and cost reduction.
Yeah, I love it.
Wait.
Go ahead, Norm. What were you going to say?
No. You, Dr.
And no,
Cole.
I mean, for me, no question, AI, both on the workflows perspective, but also in kind of the provider in the loop mentality. It just enhances so much of the ability of what a provider can do, and also enhance the visit capabilities. We're looking at a variety of different ways to incorporate that into clinical care in a safe way, with the provider in the loop, understanding the importance of that. But to Elena's point, the safety is going to be key. The second thing I would say is that just the enhanced diagnostics at home, I think, are going to enhance the ability for virtual care to really be able to provide even more care than it does today. It's not going to provide everything, but really being able to do that. And then the third thing I would say is just making certain that we can keep the empathy in virtual care is really around keeping it centered on the patient. We have empathy training for our providers, which is unique in and of itself, but it is trying to keep that human touch even in the digital world. And I think it's absolutely essential to being able to scale it and scale it well, so that we can be patient-centric in what we provide.
Well, this has been, really awesome learning about First Stop. I do think it's important as, people in industry that we practice what we preach, and that, we live it, we breathe it, we sleep it. So how do you two, in two very senior, very stressful jobs, how do you find ways, and what are your favorite ways to exercise and reduce stress?
I'm a junkie for Peloton. So
Okay. Do you have a favorite instructor?
oh god, that is just, you can go Emma Lovewell to Olivia Mata.
Shout out.
Matt Wilper's probably stretched me the most.
Yeah.
But it all depends on the mood I need, the uplifting. But I really love Peloton. I like tracking, one, how I'm doing, but two, for some reason the digital coach actually helps me. It helps me push myself.
But yeah, the accountability,
The
you're not
leaderboard
alone.
also.
Oh yeah, you're not competitive. For me, I do a lot of yoga and walking. It is so amazing. And I live in this beautiful part of San Francisco. I walk around Golden Gate Park. And I would say non-exercise stress reduction for me is writing. I love words. I love pristine, precise sentences. I like poetry. I just really like sitting down and letting my brain be creative and wander, because work, while creative, is very kind of outcomes driven and precise, and letting yourself, it makes you a better manager. It makes you a better leader when you get to experience those types of outlets.
I like it. And then I think obviously what we're putting into our bodies is a huge determining factor of health. Any favorite healthy recipes that might inspire someone who listens or watches to try something new?
For me, I try to ascribe as much as possible to kind of plant-based nutrition as we move forward, understanding the importance of protein. But I would say one thing that my wife has done that I just love are these protein balls that have good almond butter, a little bit of honey, some flax seeds. It gives you a little bit of a punch. I'm oftentimes, whether I'm traveling or on calls, I need to get something quick. And they just provide an immediate source of good protein, but also good energy to start my day.
That sounds good. Cole, are you going to make those for us?
Yeah, exactly.
Mine is Italian wedding soup, or any type of soup really, but my mom makes really good soup, and she kind of grew up and instilled in us this idea that if you have some good broth and some vegetables, it's also an extremely affordable way to make a meal really healthy and delicious. And we eat a lot of soup. Being in San Francisco, obviously a ton of sourdough bread with butter, which made from scratch
Those
can be quite good for you.
probiotics and
That's
the fact
right.
that it's fermented definitely
Yeah.
allows your body to break it down and not
it's so
turn all
different.
of those carbs into sugar.
Into sugar.
So definitely the classically made sourdough, way healthier than just what you can buy at the grocery store. So again,
Totally.
both Elena and Dr. Cole, thank you so much for joining us on the Digital Health Heavyweights podcast. Really awesome what you and your teams are doing over at First Stop, and can't wait to see what you continue to accomplish.
Thanks for having us, Norm.
Such a joy to be
Grateful.
Thank
Yeah.
you. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.